We turn now to the latest on the coronavirus. Here are 3 things to know about on this Friday morning. Number 1, the U.S. has now surpassed 4 million cases. Right now, we lead the world by far in the total number of reported cases. The next highest countries are Brazil, India, and Russia. Number 2, the number of Americans filing for unemployment increased for the first time since March. More than 1.4 million Americans filed for unemployment benefits last week. The Texas Tribune reported that more than 86,000 of those were from Texas. And number 3, Texas reported its 3rd highest single-day death toll with 173. And there are now more than 9,500 new cases in the state.
In Houston, we are starting to see a downward trend, but there is more to the story. Here's Chris Costa for a little bit of context this morning.
In the city of Houston, we've seen a downward trend of new coronavirus cases since July 17. In the last 7 days, the city averaged 820 new cases a day. A week ago, that average was almost 1,100 new cases a day. This is encouraging, but keep in mind, it's only over a 7-day stretch. Public health officials say if we keep up our healthy habits, that trend will only get better.
If you don't want a shutdown, if you don't want a 2-week shutdown or longer, then we simply need to exercise personal responsibility and put on the mask and engage in social distancing and proper hygiene.
And we need to, because the numbers are still high. In July so far, the city is averaging 832 cases a day, almost double what we averaged in the month of June. Statewide, you may see a big dip in hospitalizations, but that comes with a big asterisk. Thursday's number only comes from 84% of Texas hospitals, because hospitals are still transitioning to a new way of reporting to the federal government. Texas also added another 173 deaths on Thursday. It's the 8th day this month the state reported at least 100 deaths. And with more than 9,500 new cases Thursday, our total number of cases is now more than 361,000. That makes us 4th highest in the country. For H-Town Rush, I'm Chris Costa.
Right now, masks and social distancing are the new normal. But a lot of you are wondering when things will go back to the way they were 6 months ago. Marcelino Benito talked to one expert about his plan to contain the virus.
Dr. Peter Hotez says we are in a full-blown public health crisis right now, but he says if we act right now, it's not too late to turn things around. He's outlined a plan that will get us back to normal by October.
This is just not a normal life anymore, and I think we have to take steps.
Dr. Peter Hotez has watched COVID-19 cases and deaths climb for months, waiting, he says, for a national response. He's still waiting.
This fragmented approach, putting states in the lead, is clearly failed. And my evidence that it's failed is the United States has by far the largest number of COVID cases anywhere on the planet.
It's why he published what he calls an October plan, steps he hopes the U.S. government takes to contain the virus.
Yeah, send it to the White House. We'll see how they respond, or if they respond at all.
Hotez points to national unified responses as the key to controlling COVID. It's how European nations are largely open, back to normal, and with low levels of transmission.
But the point is, get us to a national reset at some agreed upon low level of transmission, and then we can open up schools and colleges and maybe even have the National Football League again.
He's proposing a national containment goal. Experts say it should be 1 new COVID case per 1 million residents per day. In Texas, that would mean no more than 29 new coronavirus cases a day. Each state would need to agree or be required to meet the containment benchmark to safely reopen schools, colleges, and businesses.
But at least put something on the table for people to respond to.
If those measures are met, contact tracing becomes feasible. Syndromic surveillance can keep COVID-19 from exploding, and Hotez says hospitals would be ready if it did. If we act now, he says a sense of normalcy could be within reach by October 1st.
So we have to stop getting over this magical thinking about vaccines, recognize they're not coming soon, and take steps now to give Americans a better life.
All right, Marcelino Benito, thank you. Well, amid concern from teachers, Spring Branch ISD is holding a meeting today about their reopening plans for this upcoming school year. At this point, the plan is to let parents choose between in-person and online learning beginning August 17th. But this afternoon, board members plan to talk about delaying that by 3 weeks. They expect to have that decision by Monday. Meantime, President Trump is doubling down on his decision over funding.
If schools do not reopen, the funding should go to parents to send their child to public, private, charter, religious, or homeschool of their choice. The key word being choice.
Parents all across the nation are struggling with the same decision, whether to send the kids to school or keep them home. The CDC launched an online decision-making tool to help. It caters an answer to that question depending on each family's unique needs. And you can find a link to that as well as the district's developing back-to-school plans all on our website, khou.com.
A second stimulus package is finally on the horizon. White House officials say they've reached a, quote, fundamental agreement with congressional Republicans on a phase 4 package. The current proposal would give every American making up to $75,000 a $1,200 check. But a sticking point could be the unemployment benefits, with the extra $600 set to run out. White House negotiators hope the final bill will be ready for a vote by the end of next week. The Republican National Convention in Florida is canceled. President Trump announced he was canceling the event yesterday. Florida has seen a massive spike in coronavirus cases over the past few months. Trump says the increase means the timing isn't right for the event. All right, we go